Welcome to the Performance Around the Clock podcast. I am Professor Sachin Panda, a scientist in the field of circadian rhythm. In this podcast, I will talk to experts in many different fields about science, health, and human performance. You'll also find out why circadian rhythms is my favorite topic. I hope you enjoy the podcast and thank you for listening. Welcome to another episode of Performance Around the Clock. And I'm super excited to have Dr. Emily Manoogian with me. And Dr. Manoogian just came back from an international conference organized by the Working Time Society. And why this is important is the time we work, whether you are working from 9 to 5 or at an unusual time, also affects your health. Welcome, Emily.
Hi, thank you for having me.
Yeah, so before we dig in, I would also like to congratulate you for winning this Young Investigator Award for your seminal studies on circadian disruption among shift worker and also how to fix it.
Thank you very much.
So before we dig in, what is shift work?
Yeah. So shift work is a fairly vague term, and there's multiple definitions out there. And I think the take home message is you're working outside of typical daytime hours. So the National Institute for Occupational Health and Safety, or NIOSH in the US, defines it working outside the hours of 7 a.m. and 6 p.m. But depending on where you look, there's different versions of that. And there's different types of shift work. So there's fixed shifts, like you could think there's a day shift of 9 to 5. There's also fixed night shifts, like a 7 p.m. to 7 a.m. That's a pretty common one you see in nursing, for instance. There's rotating shifts where you might switch from an early morning shift to a midday evening shift to a full night shift. That's actually fairly common among police officers and different oil rigs and stuff like that. And then you also have split shifts where you might work a partial amount of time, have some time off, work again. And then they get more complicated than that. If you think about aviation, sometimes it's a short break, you have some time off, then you're back on a flight. And so they get fairly complicated.
Oh, and that reminds me that international level organization has this kind of slightly different type of definition that when you work in a way that you have to stay awake for at least 2 hours between, I think, 10 p.m. and 5
Yeah.
a.m. For, again, they also define for 50 days in a year.
Right.
And I kind of like that definition because it clearly defines that you have to uh, either due to work or you are working. So that's why you are staying awake for 2 hours or more between what we suspect is the time or what we assume when people should be sleeping.
Right. And I think if you think about how the World Health Organization also looks at it, where they talk about the negative effects of shift work are due to circadian disruption. And it really gets to your point of this shift work is causing you to be awake when you should normally be sleeping or change your schedules in a significant way.
So then the question is, we always think that shift work, we don't think about shift workers because although from morning to evening, I cannot imagine a single hour in industrialized nations when our life is possible without the shift worker.
Yeah.
Like in the morning when you walk into that coffee shop and get your fresh bagel or any pastry, then that pastry chef might have come to work around 2 o'clock or 3 o'clock in the morning. So
Yeah.
even starting from your first cup of coffee until your nightcap, everything
Yeah.
is the Western society, this industrialized society is run by shift worker. But then why is shift work bad? Because people who work night shift, sometimes they say that they get extra money. That's why they
Yeah.
do it. But why is it bad?
Yeah. So, I mean, the real problem with shift work is that, like we said, it leads to circadian disruption. So, it's causing your body to be awake or function or be physically active when it naturally should rest. And our circadian system is such a crucial point of almost every aspect of health. And it's really kind of coordinating all these biological events, both within your body and with your external cues like light and food and social interaction. And it's really built to be consistent, to anticipate events. It's not built to move around between one time and another. It can't shift that fast. And when the circadian system isn't working, you're kind of a compromised version of yourself. So if you're predisposed to certain diseases, you're more likely to get them. And then, I think we've all felt some kind of feeling of pulling an all-nighter or jet lag where you might feel achy or nauseated or tired or moody. I think that's a good example of what acute circadian disruption is. But over time, your body kind of gets weaker from it.
So you said you use two terms here: acute circadian disruption. That's a mouthful. And can you expand what is
Yeah.
acute circadian disruption? And then the second thing that I often hear from shift worker or people who are curious about science, they say, well, if you're working at night shift for months or years, your body gets used to it. Does our body get used to it? So there are two questions: what is acute? And
Yeah. So if you think about what acute, you were just really talking short term, like right after something happens, how are you feeling? Right. And usually the circadian disruptions are annoyances, acute circadian disruptions are annoyances. Like it's not quite as severe as if you broke a leg, you have to deal with it. You get a acute circadian disruption. Okay. You don't feel great. You might feel uncomfortable or annoyed, but you just kind of push through it. Whereas chronic would be these long term, consistent over long periods of time, months, years, et cetera, that you're being exposed to something like that. And you're right. A lot of people say they find ways to deal with it that after that first, few weeks or months, it does get easier for them. I think a lot of that is if they do get into a regular schedule, then the body does adapt to a certain extent. And also, I think they find natural ways of coping with it through napping, through understanding when they should eat, when they should sleep, setting up really good sleep environments. I've been amazed at, how much they've kind of figured out just from natural, like, I feel like my body needs this, or talking to others about how they've made it work for them, that they do kind of adapt to some of these discomforts. But even in the most seasoned shift workers, many of them do eventually leave far before retirement because as they get older, it just gets to be too much.
yeah, so beyond circadian disruption, I remember when you and I
Yeah.
worked with firefighters, I
Yeah.
interacted with a lot of shift workers. And I think the challenge is also beyond circadian rhythm.
Absolutely.
So, for example, firefighters, when they're working 24-hour shift, at least the San Diego
Yeah,
firefighters do that.
many do.
And when they get a emergency call, then most of the emergency calls are actually medical emergency.
Mhm.
And if someone is vomiting or coughing or sneezing, and this was during COVID time, they're also exposed to
Yeah,
pathogens that you and I are not exposed to. So that's another kind of stressor.
absolutely.
And sometimes these firefighters are going to a vehicle accident and they're seeing really nasty thing.
Oh, yeah.
And then one firefighter once told me that in a day, whatever suffering, human suffering they see, an average person doesn't see that in a lifetime.
Yeah.
So this is almost like them needing counseling after
Yeah.
really. So there is this stress, and then when firefighters are fighting fire, there is also anything that smells unusual is a carcinogen or
Right.
toxin. So they are also exposed to a lot of toxin. And then sometimes I look at nighttime when I come once in a while to Salk, and I see the night shift watchman all alone
Mhm.
in this big parking lot, and no one to talk to.
Yeah.
And that's kind of a loneliness
Yeah.
combined with nighttime stress, working stress, and
100%.
not being able to actually sit down for a while. So there are a lot of stresses,
Yes.
and
Yes.
there is no healthy restaurant open at night time. So if this person
Yeah.
actually feels hungry, then has to eat something,
100%.
either he brought from home or from a vending machine.
Yeah.
So
No, absolutely. All of these are crucial points. Like, I say circadian disruption because that's what I think of first, but you're right. There's all these indirect effects. So whether it's, just extreme stressors from being on the job, um, both emotional and from just environmental stressors, whatever they're exposed to. And, so many of our shift workers are these vital parts of our society that are, frontline workers that's a serious issue. And then, yeah, social issues are a big thing. So there is a lot of loneliness, even on the job, but off the job. Because if you're working completely out of sync of when your family and friends are awake and you're having to sleep when they're awake, then yeah, you get a lot less family time, a lot less friend time, and it can be quite a lonely or stressful experience. It can cause strains. And then something we haven't said yet, which is kind of mixed into this, is the sleep deprivation is a very common thing because even if you get the opportunity to sleep during the day, you might have responsibilities to take care of children, or you want to see your loved ones or friends, or you're just not able to sleep. You get these short amounts of sleep, but you can't really get a full restorative sleep because your body's not really built to do it at that time. And so those combinations, I think, they kind of maybe stem from the circadian disruption, but they're all really crucial components of why shift work is so difficult.
But I think to put it together, our body's internal clock is designed for us to sleep and be awake at certain time and eat at certain time.
Mhm.
But our society is also built around the circadian rhythm. So that's why we have access to healthy food during the daytime, access to socializing during daytime or early evening, and also noise, comfort. Everything is circadian. Even our external world is circadian,
Absolutely.
designed for people who work from during the daytime. So when we work at the wrong time, it's not only our body is getting a shock,
Right.
and we also live in an environment that's not designed for shift work.
Right.
So another misconception people have is if they're not a firefighter, airline pilot, or a nurse, then they don't have to worry about it. Are there instances where people actually live the lifestyle of a shift worker, but they don't even realize?
Absolutely. I think one of the most obvious and, personally relative ones is, caretakers. And I think anyone who's had a child and any woman who's breastfed a child in those early months is a shift worker. You're working around the clock whenever you're needed. You do not get extended breaks. You are working throughout the night. And it's a very intense schedule. And I think parents, especially, especially women that are going through this, are very aware that it's hard, but I don't think you usually think of yourself as a shift worker. And it continues beyond that, whether you're while your kids are sleep training, if you have to get up in the middle of the night, it disrupts your sleep. It could be hard to get back to bed. You might not be working for long periods, but that kind of regular disruption can be quite hard. And then many people have responsibilities for caretaking that might be during the day or at night, but maybe it's during the day and then they have to get other work done during the night. So they're staying up late working at home. That's still your work affecting your off rest time when your body should be relaxing or sleeping. And so we say generally the kind of phrase is like about 20% of people do shift work, but I think it's far greater than that. And even if you don't do it your whole life, I think most of us has experienced at least some short-term exposure to shift work.
What about high school students and college students and PhDs and
Oh, yeah, there's all kinds of stuff there. I mean, depending on what your school start time is and what your activities are, there are some schools that start fairly early or even have delayed school start time that might work better for teenagers. But then many sports teams start before that. So you might be waking up very early for a school sport practice. Um, or any other activity, or many kids just have really long commute times, which can also lead to, like maybe you have to be at school at 7:30, but maybe you have to leave home at 6:30, meaning you're waking up at 5:45 or 5:30. Those are really kind of extreme starts, especially for teenagers. That can be really physically demanding. Colleges, hopefully you live on campus or something where you don't have to travel too far and your commute's a little lower. But frequently you see late night study sessions, you see all night study sessions, you see a lot of circadian disruption coming up in different ways. And then if you talk about PhDs, depending on what you're doing, especially if you're a circadian biologist, we all have circadian disruption to run some experiments around the day. But I think whenever you're, having these really intense work schedules or you're trying to achieve these kind of big goals where you're pushing and studying all the time, then we frequently kind of let that fall and we say, okay, well, I'll put the work in now and I'll ignore it for now and I'll be uncomfortable. But it does build up over time and it does usually mimic some type of shift work. Yeah.
so if we go back to the definition that we started, one of the definitions that if you stay awake for at least 2 hours, or if you lose sleep for 2 hours,
Yeah.
1 day in a week.
Yeah.
So that's 50 days in a year.
Yeah.
It sounds very benign.
Right.
1 day in a week, you can just lose sleep for 2 hours.
Yeah.
Why that has such a cascading effect, adverse effect?
Yeah, I mean, I think it's when you think about losing sleep, it's rarely isolated, right? It's not everything else in your life was coordinated and perfect and relaxed and you just slept for 2 hours less. It probably means you were out and getting different type of exposure, whether it's late night light or eating really late or something else that might also, in addition to decreasing the duration of sleep, also kind of compromise the quality of the sleep. If you're not awake or rested the next day, you might be moody, you might make poorer food choices. It might affect a lot of other things. And it kind of can lead to this cascade of events. If you didn't get a good night's sleep and you're feeling awful, we tend to treat that like over the counter with treats, don't work out today, binge watch that show, don't take care of whatever you needed to take care of. And then these things kind of build up, right? And so it's these little chronic stressors, I think, that kind of build up over time that kinda throw you off. And then even from just a metabolic point of view, say you do eat late, say you get a poorer quality of sleep, maybe your glucose levels are higher, you're constantly challenging your system. This is how you can lead to insulin resistance and things like that. Or for those that might be on the edge of having a cardiovascular event, those little stressors can sometimes be the thing that push you over the edge. And we see that in things like daylight savings time. When we get that 1 hour push, you think it's just an hour, but you see the huge increase in heart attacks that day because it's just kind of the last straw.
Yeah. No, I think you and I are aware of quite a few adverse effects of shift workers or shift work like lifestyle.
Mhm.
So let's break it down and discuss some of the disease risk or the risk for certain disease that go up. Um, for example, let's start with young children who may not be doing shift
Mm.
work,
Yeah.
but these days, many young children they also accompany their parents when they
Mhm.
go for a family get together on Saturday,
Yeah.
Sunday, and they're staying awake 2 or 4 extra hours, and then they're
Yeah.
coming home. And in some families, if parents are working late into the night, then kids may not get to sleep early. They may
Yeah.
have irregular sleep schedule. So
Mhm.
in such cases, kids who don't have a regular sleep schedule or are sleeping less, are
Mhm.
there certain health risks, whether it's mental health or metabolic?
Yeah, I think there's been a good amount of data to show that kids that don't get enough sleep are more likely to present or test positive for ADHD, attention deficit hyper disorder. They're more likely to have problems learning in school or being focused. They might be more irritable. They might have act out more in class. And as you get into like teenage years, you're getting a lot of hormonal changes. And the hormones are also circadianly regulated. And so when you're messing with that system, you're much more likely to display mood disorders or behavioral issues just because you didn't get a regular, quality sleep. And adjusting that can have really big benefits, actually.
So that means when in high school, starting from high school into college, nowadays we are seeing more and more young adults, teenagers, and college students. They are
Mhm.
complaining, or they are not complaining. They are actually getting diagnosed with
Yeah.
mood disorders,
Yeah.
depression, bipolar,
Yeah.
anxiety, um, and sometimes OCD.
Right.
Um, so you're saying that some of that may be due
Yeah.
to circadian rhythm disruption. They're staying awake late into the night, thinking that are working hard for their grades, or that
Right.
doing a part-time job to pay for their college, but that's actually maybe contributing.
Right. Anytime you get some kind of benefit, like extra time in the day, you're paying some kind of cost. And some people can handle it better than others. But yes, circadian disruption has been linked to all kinds of, very well linked to affective disorders like major depressive disorder or bipolar disorder. So it might be a situation where someone may be more predisposed to that, and that kind of disruption really just helps it come out. And getting them back on a regular schedule, getting adequate sleep could be very helpful for those individuals. Yeah.
And then, is there any metabolic effect of circadian disruption? Like, for example, starting from bowel movement or gut
Yeah,
health, and maybe eating disorders or eating
absolutely.
too much.
Yeah, 100%. There's so much there. This is gonna be a long-winded question, so you might have to stop me. Um, no, there's so much in metabolism, right? So starting with bowel movements, right? You can learn a lot from bowel movements and not just microbiome, but just the timing of it. If you kind of have a regular circadian metabolism going on, you're probably pooping in the morning around the same time every day. If you're having really erratic poop schedules or like inconsistent or irregular, that probably means your system's not working quite right. And even just the simple thing of regularity of bowel movements can tell you a good amount. Um, but our metabolism is very different at different times of day, and it gets kind of complicated with the circadian system coordinating so many different things going on in the body. But during the day, our bodies are meant to be able to take sugars in the blood and store them away for when we'll need them. And during the night, we don't do that because your body expects you to be fasting while you're asleep, right? And so it usually releases those sugars. But that means that if you eat when your body thinks you should be fasting, you now can get these really elevated glucose responses that stay high for long periods of time, especially if you eat really close to when you go to bed and then you go to sleep when your glucose is still high. Instead of coming down as it normally would, it can just stay elevated for really long periods of time. That kind of increased blood sugars over and over again are things that lead to um, insulin resistance, can lead to prediabetes, type 2 diabetes. So those are serious challenges there. And I think it was the World Health Organization that's talked about how circadian disruption caused by shift work or other things, social or work reasons, it exacerbates arthritis, cardiovascular disease, type 2 diabetes, any kind of metabolic disorder, because it really is forcing a machine to do something it's not built to do at that time, right?
Yeah.
It's like forcing an incompatible event. And if you do that over and over again, you break the system.
Yeah. So that's a very nice way to explain how metabolism and circadian disruption works. Um, but then we talked about up to college ages, and
Yeah.
now people are getting out of, so finishing their
Yeah.
college and getting into doing their regular
Hmm.
job. Um, so what happens in young adults
Hmm.
in their late 20s, mid 30s, for example? That is when they're starting a family or trying to start a family. And if there is circadian rhythm disruption, people are doing night shift work. Of course, it will be very hard to find a spouse.
Yeah.
But if you find a spouse,
Yeah. It's hard.
then
Yeah.
then does circadian rhythm disruption due to shift work like lifestyle affects even your ability to conceive or have children,
Yeah.
or how healthy will be your pregnancy, all that stuff?
That's a whole other issue, right? So, circadian disruption has also been linked to infertility. And again, this gets back to hormones being regulated by the circadian system. Some women also report irregular menstrual cycles, which I think is reflective of that. And so, for some people, they get off of shift work so they can have children. It's also common to see weight gain with shift work, again, probably because of the mistiming of all of these things and being able to process the food properly. I found it quite interesting. In certain countries, it's illegal for women who are pregnant to work more than one night shift in a week.
Hmm.
So it went from, they could work 3 or 4 days a week to you cannot have them work more than one night shift in a week. There's increased rates of miscarriages for women who are pregnant that are working night shifts. And so we know that there's a lot of associations that make it a lot riskier. Not to say that no women on shift, there are definitely women who work shifts that have had healthy pregnancies, and not to say anything that that's not possible, but the risk is harder. It's a challenge to the body that makes it harder than it would naturally be.
Yeah. And then now, if we move on to middle age, when the age related diseases like diabetes, cardiovascular disease, heart disease, for example, and then hypertension, all of these, they're more prone to.
Yeah.
Um, does shift work increase that risk?
Yeah, absolutely. I mean, shift work or circadian disruption, like we said, and it's not just being active at the wrong time, it's eating at the wrong time and not getting enough sleep or sleeping at the wrong time. It's these social stressors, other exposures that you might get. All of those things can increase risk for cardiovascular and metabolic disease. And again, when we think about like diabetes, we're thinking about glucose a lot. But when you think about a cardiovascular event, like what's actually causing that? And it's no one thing. I mean, the circadian system actually regulates so many different parts of your cardiovascular health. We think about when you produce cholesterol, when your heart rate is higher or lower, when your blood pressure is higher or lower. We naturally have these peaks in the morning to help us wake up. We have these cortisol peaks. We have all this. But also, you have changes in arterial stiffness that are going to make it more or less likely to have a heart attack that change throughout the day. And all of the timings of those things is based off of you're sleeping at night, you're active during the day. And when you go off of that system, you can lead to these incompatible events that if you're really healthy, you don't really notice anything. But if you're already having, compromised cardiovascular health, that missed timing can kind of push you over the edge.
Yeah. And again, the ultimate or the most extreme age related diseases are cancer and dementia.
Yeah.
And now I guess World Health Organization has linked quite a few cancer types to
Yeah.
certain.
Right, they consider shift work, um, or circadian disruption caused by shift work as a probable carcinogen,
Mhm.
right? That you're increasing your risk for cancer, probably through inflammatory pathways, that you get more inflammation, you're not able to clear out the system properly. And again, this really has multiple facets. It's not one thing happened and it causes cancer. It's all these different effects that you're getting from shift work that are really multimodal.
So we are talking about a lot of different diseases throughout the lifespan.
Yeah.
So there is also a lot of progress in medicine.
Yeah.
There is almost means people means I also often complain, but then the bottom line is we have much better treatment now than when I started going to college.
Yeah.
In the last 20 plus years, there are
Mhm.
much better treatments. The question is now, do shift workers benefit to the same extent by taking the same medicine as the non-shift worker? For example, suppose a regular worker and a shift worker, they both got type 2 diabetes diagnosis. Will the diabetes medication work to the same extent in both?
Yeah, probably not, right? I mean, there's a lot of reason to believe that it would not because it's built to be active and affect systems that are active on certain times of day. And all of those systems are going to be a little compromised on shift work. The other thing is we don't fully know because shift workers are almost always excluded from clinical trials. And if you look at like clinicaltrials.org, where you're looking at all these registered trials, only 0.0005% of studies include shift workers. So a lot of is not known, right? And it's sad because they're probably taking the most challenging and have the most risk, and we're not really studying them. But if you look at the logical reasons of how is the system working? What is the medication working on? How do we know, why you would take it at one time of day versus another? Then absolutely, it seems like shift workers would be compromised for most medications.
Yeah, actually, I was going through, I think, hypertensive medication or metformin data, and then it doesn't, these medications don't work to the same extent. Like, for
Right.
example, if somebody is newly diagnosed with type 2 diabetes and
Mm.
is prescribed a 1000 milligram
Yeah.
metformin, it might reduce, say, hemoglobin A1C by zero point 0.5 in a regular worker, but
Mhm.
may not reduce to that extent in a shift worker. So I think I saw one of the papers. So the bottom line is, if you're a shift worker, you have to actually learn how to adapt and manage that shift work much more carefully than a regular worker, because falling sick is not as is actually worse when you are a shift
Yeah.
worker.
I mean, and your whole immune system is compromised. You're more likely to get sick. You're more likely to have a worse sickness from it. Unless you can get time off to recover, but you're really a compromised version of yourself. You're a weaker version of yourself because you're challenging your body all the time. So you think of it as an additional load you're carrying all the time, this burden you're kind of carrying around, then anything else that kind of adds on there is more likely to take you down. And so it really, like you said, optimizing everything you can is super important to kind of lessen that load and make it easier on your body. So things like eating at the right times, getting the best sleep you can when you can, creating a schedule that works for you and your family. All those things are really important because it is these little pieces that over time will make a big difference.
Well, we should not actually say that shift work is so dangerous that one should not do it. The way I look at shift work is, if you are, um, I don't know whether it will offend anybody, but suppose you are a regular helicopter pilot um, who does short distance flying
Sure.
versus the Top Gun fighter jet fighter pilot who is
Right.
actually doing much more dangerous trips and at the same time has to be extremely trained
Yes.
to do that job. So if you are well trained, then you can actually um, get shift
Yeah.
work done and make a nice living and contribute to the
Absolutely.
society. So then my question is, when we started, you discussed different types of shift work.
Mhm.
Are there certain types of shift works that are scientifically proven to be less dangerous than other types of shift works? Or, in other words, who decided whether somebody should do 2 days a
Ah,
week, 3 days a week, or how
yeah.
many times they rotate? And who decides that?
Yeah, I mean, all shift work evolved to have people working around a clock, right? Or extended hours at least, or full 24 hours, that there were things that needed to be, jobs that needed to be done in extended periods. And so you work in shifts. I mean, at most basic level, right? And so a lot of it was decided by trial and error or for financial reasons by companies that were running, that employed people who did shift work. That being said, there is a fair amount of science now working on trying to optimize those shift schedules. And, especially in aviation, there's a lot there to try to say, okay, these are the schedules you can do, or things like turnaround time, like how fast do you have to come back to work. I think it's pretty well known scientifically that if you have to come back within 12 hours or less, you're not going to have enough time to get an adequate sleep, whether it's commuting or eating or taking a shower, doing anything else a human needs to do. You're not gonna get 8 hours of sleep if you have less than 12 hours off, and even 12 hours is pretty, reduced. I think some of the newer stuff is saying closer to 15 hours off is ideal. Um, but so sometimes that is incorporated into work schedules of trying to make sure you get a long enough, break before you have to come back to the shift, even if it's a very difficult, night shift or something like that.
But there are some shift work, like mentioned San Diego
Mhm.
firefighters do 24-hour
Yeah.
shift, one on, one off, one on, one off, and then they do
Yeah, they
four
can.
days.
They can do up to 4 days in a row.
They can do
They can do
four
up to
days,
4 days in a row.
like overtime.
No, that's can typically so they are supposed to work, I think it's like 10 or 12 days in a month, but they can do them up to 4 days in a row without taking a day off. That's not considered overtime. Overtime comes from more days working in a month. So
I
if you
see.
work more days within a month, but no matter how many days you work, you're not allowed to work more than 4 days in a row unless there is a current
Fire.
fire emergency. In California, we have an amazing, fire safety network where there might be a fire in Sonoma, but San Diego firefighters might go up there. They kind of move people around to help and support each other, and it's a great system. But that also means when there's a real emergency anywhere within the state, if some of your other firefighters are up there, you might be working overtime here, and that could mean working more than 4 days in a row.
I see. So that's one type of shift work.
Yeah.
And then um, nurses, you mentioned,
Mhm.
they are never required to work 4 days in a row, right?
No, usually it's a 3 days in a week situation, but what that looks like can be really different. It could be 3 days on, 3 days off. It could be every other day. You might pick up an extra shift here or there. So they usually average around 3 days in a week, but that can kind of flux. Yeah,
But then a local San Diego police department is different.
very different. So there you do, a morning, an evening, and a night shift, and they'll stay on one of those shifts for 3 or 4 months at a time.
3 or 4 months.
Months. So they're doing this kind of in thirds around the year, not quite quartiles, but they'll be on that for about 4 months at a time, and then they'll shift to the next shift, and then they'll go around. So they have some time to get used to that shift, And talking to some of them, it was interesting because they said, okay, well, this shift is the easiest on me physically, but it's the worst for my social life. And it's the worst. I don't get to see my family, and if you're working the night shifts in the winter, you may never see sunlight, so there are different challenges to each shift and even to that same shift at different times of year.
Hmm. So that means even if you solve the problem of firefighters, it may not solve the problem of the police or the nurses.
No, I think there's many unique challenges to every type of shift schedule, and even saying nurses or firefighters, that's not the same schedule for all nurses. That's not the same schedule for our firefighters. So for every shift schedule there's probably going to be some general rules that you should follow, but there's going to be individual personalization that I think needs to be worked out for each one.
So that means a shift worker really needs a life coach.
Yeah. Yeah, I mean, I think a lot of it is learning some of the core principles of what you're trying to achieve and then figuring out how you can make that work for your schedule. I was talking to a pilot the other day who was telling me how, like, when he had a fairly quick turnaround, even if he was in his home city, he would not go home because if he did, he would see his family, he would talk, he wouldn't get enough sleep. So he would stay in a hotel locally so he could turn the lights off, go to sleep, and be able to get up rested for his next flight. And so it may not be the most fun. It might be hard to be away from people sometimes, but that's what he needed to do to be rested. And that's what, he figured out the schedule that worked for him.
Yeah. So you have published a nice paper on optimizing healthy lifestyle among firefighters. What was the study and what are the findings?
Yeah, so that was our Healthy Hero study. Because just like many other shift workers, firefighters are really the heroes of our society, taking care of us and watching out for us around the clock. And so that study was really looking at changing food timing as a way of trying to improve the health of firefighters because we can't change when they get a call. There's been attempts to try to expand sleep duration, but again, you just don't usually have that opportunity. We can't stop their light, but we can change food. And so that was a pretty straightforward study of we had 150 firefighters, and half of them were put on what we call time restricted eating, which is there's no calorie restriction. It's just you contain your all of your calories into a consistent 10-hour window. So I think the most common one that people chose was 9 to 7. And I say people chose it because it was personalized. It had to end at least 3 hours before their typical bed, but they otherwise could choose the schedule that fit for them. And so it's really about having all your food when you're awake and active. And for a shift worker, that's a little more complicated. But one nice thing about 24-hour shifts is they're still mainly awake during the day. They're still trying to sleep at night. So this is a little bit more accessible for them, I think, than some of the more complicated shift schedules. And at the end of that study, we found that the individuals that were on the time restricted eating had a lower VLDL, which is a very low density lipoprotein, which sounds complicated, but it's important because these are the kind of fats in your blood that are going to build plaques. So we can eat these like chylomicrons, which are these big, plaque forming fats, or our body make these VLDL particles. And we saw that those VLDL particles were actually shrinking, even in participants that were healthy, which was really exciting to see. And then we also saw that in individuals who had elevated HbA1c, so like blood sugars or elevated blood pressure, that just changing the timing of when they eat also significantly decreased those. And again, in the full group, we also saw that they had better emotional stability, whereas the group that didn't have the time restricted eating showed decreases in emotional stability and emotional strain over the period of the study. So that was really exciting to see, and that there were no negative effects. People didn't mind not eating, they didn't feel hungry. They actually said they felt more energized. And so that was a really great first step, I think, to seeing how just changing the timing of your food could have really big long term impacts, even when you're challenged with shift work.
But can you apply that to nurses, for example?
Well, that's what we're testing.
So what is this new
Yeah.
study?
So our new study is the shift study, and it's a little bit more nuanced. So it's we have an ad lib group that's monitoring their food. So the daily monitoring is kind of an active intervention
So
control.
let's begin with, so who
Yeah.
can participate in these
So yeah,
studies?
the shift study is aimed for nurses and nursing assistants who are working 12-hour night shifts at least 3 days a week.
So only nurses and nursing assistants, not physician assistants, not.
Correct. It's dosing.
emergency emergency
Yeah,
work.
so the idea is to have a very similar environmental
I see.
exposure. Yeah. And in that study, there are three different groups that you could be randomized to. So, one is a daily monitoring where you're monitoring all of your food and dietary intake and getting kind of standard of care health advice. The second is a time restricted eating where you pick the 10 hours during the day. So, that means when they're working a night shift, they're not eating. They're allowed water, prescription medications, and black coffee or tea, but no other caloric food. And then there's a third group, which is that same time restricted eating, but we're also providing a low glycemic snack during the night shifts only. And so this is really to test of if you are awake and active throughout the night and you may be getting hungry because you are using more energy at night than a normal person would when they're sleeping. Would a low glycemic snack, meaning it doesn't cause a big glucose spike, be okay? Could you still see benefits of this kind of daily fasting aside from that? Um, and make it maybe more feasible. So we're trying to test all three interventions to see if any of those could, you know, improve the cardiometabolic health of nurses.
So we want to see whether it improves. So that means, do the nurses have to have some cardiovascular disease to begin with?
Not exactly. So we do require an elevated BMI, but we do not require elevated glucose in this study. Um, Part of that is because we're not only looking at like A1C levels, where think of like prediabetes or diabetes diagnosis. One of the other things we're really excited about is that we're looking at glucose variation. So as part of the study, throughout this year-long study, both at baseline and then at 3, 6, and 12 months, participants will wear a continuous glucose monitor, which is assessing glucose levels about every 5 minutes for 10 days straight. And we can see how their glucose responds throughout the day, but also very importantly at night when they're on their shift and seeing that variability and how that changes. And so, even in someone who is metabolically fairly healthy, we expect that we'll see decent changes in the glucose responses.
So let's go back to the intervention,
Mhm.
because when you said that they cannot eat
Yeah.
during the entire night shift, how
Mhm.
long is their shift?
So their shift is 12 hours. They work most of them work a 7 p.m. to 7 a.m.
How many days in a week?
Usually typically about 3.
Three
3
days in
days
a
a
week.
week.
Okay.
Yeah.
So that means what time typically, you said that this is a self, they
Yeah.
can choose when they want to eat.
Yes.
Can they choose to eat say between 12 noon and midnight?
So they have to eat their end time has to end at least 3 hours before they would normally go to sleep on a day off. So if they're going to bed at 2 in the morning,
On
then
the day
yes.
off. On the day
On
off.
their days off when
Yeah.
they're not working. If they normally would go to bed at 2 a.m., then you could potentially go as late as 11, although we haven't actually seen that, but theoretically. If they're naturally going to bed at midnight, then their last meal would probably need to be around 9. That being said, because they have a 7 to 7 schedule, typically they've been picking things that would maybe 6 or 6:30 would be the end time, and or 7 maybe, so they could get a meal in before they go to work, and they try to stick to those times on their off days as well, and that also allows them to eat not too late after their shift ends if they wanted to eat before they took their nap that day.
Okay, so it's 3 days in a week
Mhm.
that they're working. So that means it's 12 to 14 days in a month that they're working.
Yeah, on
Yeah,
average,
yeah.
yeah.
And I remember that in some of the studies, even if participants follow this time restricted eating for 5 or 6 days in a week, then they do see some,
Yeah,
maybe not all, some benefits. Is
yeah.
that right?
Yes. So a lot of studies have shown that you get at least 5 days in a week that you'll see some benefit, which is partially why we think we might see some benefit from the low glycemic snack. That being said, in those studies that have the 5 day a week thing, you're not usually seeing middle of the night eating,
I
and
see.
you're not usually seeing people who are awake at night. You're usually seeing people who eat later in the night. Maybe on a Friday or Saturday night, you go out and you have desserts or drinks or some kind of entertaining food, and you cheat a little bit on those days, you still see a benefit from the rest of the week where you did well. I think shift work is trickier because, in one hand, you might be using up calories that you're eating because you're active, which would be kind of a pro in the like, okay, well, it's not like you're eating and then just laying down. But at the same time, you're probably eating more extreme hour
Mhm.
differences, in the middle of the night. And honestly, there's just a lot to still be discovered on how to deal with that.
Yeah. So how is the recruitment going?
Recruitment's going. We've seen a really great response from whenever we've talked to nurses about it, being really excited about having any intervention that could potentially help them and be excited about it. But like with any clinical trial, there's always recruitment challenges and getting the word out there. So if you're in San Diego and you'd work night shifts and you're a nurse or nursing assistants, please call us.
And then they have to be how much body weight you said? The BMI has to be
Just 25 or over, so it's pretty mild. It's just technically
25 or
25 or higher, but again, that some people that are even not overweight but have higher muscle can hit that, so
yeah. But
yeah.
on the other hand, like I'm from India, and then the Indians and many South Asians,
Yes.
when they are BMI 23, that is similar
Yes.
to BMI 25 for
Yeah. So
Western.
I simplified that. There will if you are of Asian descent, there's a slightly lower BMI cutoff. So the general idea is that you hit a BMI definition of overweight, because we do believe this would also lead to weight loss. But it is not a severe
Mhm.
overweight. It's pretty mild.
And then, what is the known effect of time restricting on mood or sense of energy? Because these are night shift nurses and
Yeah.
nursing assistants.
Yeah.
If they make one mistake, then
Absolutely.
there is more serious consequences
Yeah.
than me making a mistake
Of course.
writing a
Yeah.
email.
Of course. And so I mean that's one reason why black coffee and tea is always allowed, like the caffeine need is there if they feel like they need it. The nice thing is most time restricted eating studies have shown improved energy or alertness or clarity upon fasting. Especially once you've done it regularly and your body expects it. I think, the first couple weeks your body's adjusting to it. It's expecting food and it doesn't come, and then it can be kind of confusing. But the more, regular you are with it, I think the more improvement you see there. So again, it hasn't fully been done in shift workers aside from really short term few days within a lab. There's been some beautiful work done on that kind of scale. But as far as long term, we haven't really done it yet. So we're going to find that out.
How many other interventions have been tried on night shift workers to make their life better? Are you
Not
aware of?
very many. I mean, there's been some to try to extend sleep duration, which has been very difficult and not very successful. There's some to improve sleep kind of hygiene, you call it, where cool, dark, quiet room. And I found shift workers are usually very well aware of that, and they do maximize that, which is great. But I haven't seen. I mean, there's been very few other studies. I think like 0.0005% of studies out there. I mean, it's a very small number of trials that have been interventions. Almost everything where you see research in shift workers is observational data or retroactive, looking at electronic health records, or some countries you can look at payroll and electronic health records where you can kind of look at associations between health and shift work or even accidents that happened on the job. But as far as interventions go, I mean, it's really just a handful.
So I was struck by one of your comments that you said there was some studies on how keeping the room cooler and having a dark room helps shift worker to get sleep. And then the next sentence you said that many shift
Yeah.
workers are aware of that. So
Yeah.
that says that even though that study to see whether dark room and cooler temperature helps shift workers get extra sleep. Maybe it was done on small number of people, maybe only once, may not have been even repeated, but that had a huge impact
Yeah.
on all the other shift workers who are craving to get
Yeah.
some information so
Yeah.
that they can adopt in their life,
Yeah,
right?
and I think, that kinda sleep hygiene work, it in shift workers that was tried, and it kinda showed a proof of concept that that's the same kinda advice you get for anyone to have good sleep hygiene,
Yeah.
right? And so, it's important whether you're working shifts or not to get those kinds of things, and so people have usually heard about it one way or another, but I think you're right, these shift work studies are super important because there are so few of them, and when you do have one, then it makes noise because there's not a lot else there. And you can potentially make a big change. And I think part of that is because the shift workers know it's challenging. I mean, you're not going to go to a shift worker who works night shifts and they'll be like, "Oh yeah, it's fine. There's no issues." They all have some kind of a challenge. Some might feel better or worse, but they know there's a challenge. And so if you tell them I can make it easier on you, they're really excited about it and they're willing to try it. And I think so much of getting shift work to work for you is trial and error and figuring out what works in your life and even that stage of your life that might change as you age or your life circumstances change. And so when you get a new intervention that has promise, I think a lot of people are excited to try it.
Yeah, because I remember when you published that firefighter study. After that, in many fire stations in San Diego, people actually firefighters printed
Mhm.
out all the
Yeah, the handouts, made
suggestions and
little, yeah,
handouts you
made
had given,
binders.
and they put it in the binder. So then it shows that even though only 75 firefighters tried time restricted eating, it actually impacted the health of all, or at least 800 firefighters who work for San Diego
Yeah,
Fire and Rescue actually heard about it, and
yeah,
many of them tried it. And now, actually, a couple of years ago, I went to a fire conference, and then I was surprised, pleasantly surprised to see that a lot of firefighters actually knew about it. So
yeah.
in that case, I think I always come back to this impact of clinical trials.
Mhm.
Like when you do one clinical trial, particularly on very specific population like
Yeah.
night shift worker, although you may be living in San Diego doing night shift work as a nurse and you participate and you are thinking that you are only one among these 30 or 40 people who did this study. I think if they do the follow the protocol correctly and then they can report what works, what doesn't work,
Yeah.
that can impact the health of many millions
Yeah.
of night shift
Huge
workers.
impact, and I think that was one of the reasons the firefighters are so excited about it too, is they see it as helping their fellow firefighters, and I think nurses understand that as well, and that's been one of the things they talk about is, like, "We wanna make this easier on everyone." I was actually kind of exciting when I was at that conference, there was a researcher from Australia, Charlotte Gupta, who was looking at social media, that where shift work is talked about and how they talk about it, and a lot of shift workers, are also on TikTok and are sharing what works for them or what doesn't. And then a firefighter was actually sharing the study that we
Uh,
did, and it was called out in the talk. I was like, "Oh, that's really cool that people pick it up and they share it in many different ways." And because there is so much just kind of having to figure it out on your own, people talk to each other. And if they've had that experience or they've, had a benefit from that, there's a lot of sharing of word of mouth as well. And so yeah, there's many ways we have to kinda get that information out there, but it was really exciting to see
Yeah.
that someone else was sharing it, on their own.
So coming back to your study on night shift worker. So you said that you want to see cardiometabolic benefits.
Mhm.
But now if we go back to, there are now what, at least 150 time restricted eating studies
Yeah.
published.
Mhm.
And also there are many animal studies. Based on all these studies and based on what we know, the middle aged or young adult nurses are fighting with in their life,
Yeah.
what are the other potential benefits
Yeah,
that
so
they may experience? Let's start from glucose, then heart,
yeah,
mental health, gut health, energy,
reproductive health.
reproductive health. Yes.
There's a lot of 'em. Okay, so we gotta go one by one. So, yeah, I mean, glucose is a big one. I think we've talked about that a little bit already. We know that eating at the wrong times of day leads to elevated glucose response, even the same meal on the same person at the wrong time. And there's been some beautiful work on that from Frank Shear's group and Siobhan Banks's group. Even if at night you're okay, the next morning you have a compromised glucose response. And having that elevated glucose, again, these are things that lead to insulin resistance and weight gain and those kinds of problems,
So
or
in
the ability to lose weight because you're not burning fat at night because you're still eating. Yeah.
so in common term, pre-diabetes or type 2 diabetes,
Yeah.
that's insulin resistance,
Yes.
right?
Yes.
And
Yes. Good
then
point.
nearly at least 50% of adults in California have pre-diabetes. It's
It's a
50% of
very
all
widespread
adults,
thing. Yeah.
all adults.
Yeah.
We're not
It's
talking about
extremely
people.
common.
Yeah.
Yes. And most people, over 50% of people also probably have a long eating window, right? Or they're eating
Yeah.
at the wrong times of day. So yes, glucose is a big thing. And, there's been a lot of work to show that changing when you eat can have a big effect on your nighttime glucose, your overall glucose levels. If you go to heart events, again, eating at the wrong time. I mean, part of that is entangled in the prediabetes, diabetes story because those things also increase your risk of a heart event. Eating at the wrong time, sleeping at the wrong time, getting light at the wrong time, all of those things can increase your risk for a heart event as well.
When you say risk for heart event,
Yeah.
that means your cholesterol is
Increase
high
I mean, it could lead to higher cholesterol, yes,
or
because
blood
we do
pressure?
see blood pressure and cholesterol go down in a lot of our time restricted eating studies. So for people who already have elevated cholesterol, specifically LDL, which is like the bad cholesterol, or elevated blood pressure, even when already on hypertensive medications, we've seen those things come down just by changing the timing of when they eat. And so obviously that would decrease the risk for any heart events there. Um, I think some of the other things you mentioned, because it's quite a list because it affects so many different things.
Yeah, mental health.
Mental health. So that's another big one. And we talked about that a little bit with the firefighters that when you're on a regular eating schedule, it is associated with better, more stable mental health. And I think, again, it's just like we talked about shift work. It's not just the eating alone. Eating late at night can lead to increased glucose while you sleep, which might mean you don't get as restorative of sleep. You might mean your gut doesn't restore as well. Microbiome is linked to mental health. Sleep quality is linked to mental health. You might be staying up later because you're eating food and that's stimulating and you stay up and you entertain yourself. And so then there's sleep disruption issues. And all of those things kind of together can lead to increased risk for mental health issues. And then when you think about energy levels, again, for a lot of those same reasons, you can have, you could feel more fatigued, or then maybe you don't work out and you don't get other health benefits from those types of things. Those things go down. And then when you think about it from a reproductive point of view, I think very little has been done in men, and not much has been done in women. But we know that there's hormonal consequences of circadian disruption. And when I say circadian disruption, that could be sleeping at the wrong time, getting the wrong light, getting the wrong food time. I mean, mistiming really any kind of these stimulating activities that tell your body it's time to be awake. Um, so that can mean infertility, that could mean irregular menstrual cycles. It's also been linked to PCOS, which is polycystic ovarian syndrome. And there's been some smaller studies that have now shown that time restricted eating can help decrease symptoms of PCOS, which I think is a really exciting field. There's been some studies starting to explore even gestational diabetes and if time restricted eating might have a role there. Um, because again, it's really a way of helping the body, process glucose at the right times and avoid it at the wrong times when your body's just kind of compromised and not able to do as good of a job.
It also improves the gut health, I guess.
Yes, so gut health also improve, and a lot of that may also be linked to the microbiome, like Amir Zarimpar's work and Amandine Shek's, and also in your lab that have shown that the microbiome does respond to eating times and time restricted eating does improve kind of microbiome health, and that affects the gut as well. But you think about maybe gut repair mechanisms, if you're eating at all times of day, you don't ever really get to restore that gut, whether it's gut lining or other things that you really need that fasting period to be able to make that kind of restoration.
So that means what you're saying is the list that we went through.
Yeah.
I was thinking like almost every shift worker who has worked for 4 to 5 years of shift work is very likely to have one of these conditions.
Yeah. Or at least been challenged with it. Yeah.
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 So that means if you're listening and if you live in San Diego and you are overweight by definition, then there is a very good chance that they will qualify to be in your
Yes.
study.
Absolutely.
And yeah, hopefully we can do this study so that 2 to 3 years down the road, will you are also measuring comprehensively a lot of different things,
Yeah.
right? So you also take blood and test them for 1,000 different
Yes, it's an
proteins and
extensive
hormones.
blood work. We have full body composition DEXA scans. We're doing blood pressure at different times of day, nutrient composition at different times of day. There's a lot of data that we'll get. And I think one of the really cool things about participating in this is you get a really comprehensive understanding of your health and how it changes throughout the study. And a lot of these are tests you cannot easily get at your doctor's office or would have to be prescribed. And you'd usually have to have a more severe syndrome to get that, but they're really crucial for understanding so much about your own health. And so that's actually one of the really big benefits you can get is you get that benefit for yourself to understand your health better and that, will stay on your medical record so you have that as a in reference. you help your fellow colleagues that are going through a similar challenge. And I think those are two really big ones. And then hopefully you get your own health benefits. You also get some financial compensation for your time. I think it is a commitment to participate, but I think there's a big payout, multiple levels.
Or at least, every participant in a clinical trial, whether you are in the intervention group or in the standard of care group, the knowledge from a good, well-run clinical trial actually impacts the health of millions of people. So
Absolutely.
your participation, one's participation, actually impacts the health of a million people. So it's almost like you are a billionaire who is handing out this philanthropic money to improve the health of a
Yeah.
million people. That's how I
Yeah,
look at
that's a
it.
great way to look at it. I mean, we cannot do our work without participants. And so we are always extremely grateful for anyone who will donate their time and their energy towards testing out some of these, behavioral interventions, especially that you need to do it well and we need to know if it works. We don't know until we try it. And so participants are kind of the lifeblood of clinical research.
Any last word for shift workers or regular workers?
Yeah, no, I mean, whether you do shift work or you just are an adult, life can be hard. We frequently disrupt our rhythms, but I think there's these little things we can do to tweak our schedules that, you don't have to give up everything or be, super restrictive on yourself. But there's these little changes we can make that can really build up to support your circadian health and make you a better version of yourself.
Yeah, and also if you are not physically present in San Diego and you don't qualify for these studies, the people can still download our app,
Absolutely.
right?
Yes, you can download the My Circadian Clock app. It's a full research app. It's free to use for iPhone and Android. You can log for baseline, just like 2 weeks, to just understand what your current eating looks like. I think that's important to have a understanding of where you are now. And then you can set goals. Maybe it's a 10-hour goal, maybe it's a 12-hour goal, whatever it is. And you can try to kind of get yourself on track on your own as well.
Yeah. Thank you so much. Means
Yeah.
these are very profound foundational studies, and they, as you said, that you did one study, and it's gratifying to see someone from Australia. You did this study in San Diego.
Yeah.
Someone from Australia saw
Yeah.
it on TikTok and shared that in a
Yeah.
conference in Brazil.
Yeah.
Right?
That's a good way of putting it. It really got around the world. Yeah.
Yeah, it
Yeah.
really got around the world.
Yeah, that's a great way of putting it, right? Because I mean that those participants shared that knowledge. It's an international thing. And the shift work conferences, they're not huge conferences, but it's a really tight-knit group of a very international cohort and everyone's, doing what they can to make a difference.
Yeah, and also during that firefighter study, we made a movie
Yeah.
called The Healthy Heroes.
Yeah.
And someone, when I was flying, I think to Singapore, somebody told me about that movie,
Really? Oh, wow.
Healthy Hero. And then I was like, yes, these firefighters who did, they are really heroes because
Yeah,
now they're in the
absolutely.
movie.
I mean,
Um,
so are the nurses. Yeah, I mean, so I'm all of our frontline workers. It's amazing. They have to be very skilled, very diligent. They get so many challenges thrown at them, and we need them so much. So anything our research can do to make their lives a little bit better, like I'm very proud to spend my time doing that.
yeah. Thank you so much, Emily. And then for rest of you, if you are listening, then please spread the word about
Yeah.
this shift work trial. If you live in San Diego, then for the next, so now this is around November, December 2025. And I guess your recruitment will continue till 2026, December or
Probably
2027,
early 2027. Yeah.
maybe 2027. So if you're listening to this or hearing this up to 2027 June, then there is a good chance that you can be in Dr. Manoogian's study. And if you're not in San Diego or do not meet this criteria, then you can still participate by downloading the app My Circadian Clock, sharing your data, because everybody's data, even if you're sharing through the app, that impacts thousands of people. And thank you so much. And I'm looking forward to some new results in a few years.
Yeah, me too. Thank you for having me.
Thank you.